We are live.
A very good evening and a warm welcome to one and all. I welcome you to the Gyan Pravah podcast series, The Flow of Knowledge, episode number 124. This is the Foxy presidential initiative of our own President Foxy, Dr. Sunita Tandulwadkar Madam. ज्ञान का बढ़ता रोजाना एक नया अनोखा रंग हर रात 8 बजे जुड़िए आप फॉक्सी के संग. This was wonderful that Madam had started from day one. So, myself, Dr. Supriya Jaiswal, Chairperson of Adolescent Health Committee of Foxy, is your host today. And as guest speaker, we have none other than Dr. Bharat, Madam from Bangalore. The topic of discussion is Sustainable Periods, Healthy Planet. As we have celebrated 28th May as Menstrual Hygiene Day, I thought it would be the apt topic of discussion and dialogue on this podcast. So, before I begin, I would like to introduce our own President Foxy, Dr. Sunita Tandulwadkar, Madam. Madam, what to say about you? Madam, you are on mute.
Today we have a Minakshi ji. She knows me very well. She is our very much Foxian. So I request to introduce me better.
But two lines, Madam. Madam, I just wanted to say this President Foxy, Dr. Sunita, Madam, has given so many projects. And to the chairpersons, to the VPs, we are overflooded with number of projects. And she has given us a free hand to showcase her talent. A number of important projects like Know Your Number, Gyan Pravah, then blood donation campaign, Madam has given us tremendous opportunities. So thank you, Madam, from core of our heart for this.
Thank you, Supriya. Thank you.
Thank you, Madam, to welcome the guest.
Thank you. Meenakshi ji's second time on podcast indicates how popular she is. And what is important is the topic which menstrual hygiene is very close to her heart. I know her. I think that time she was very active in Foxy 10, 15 years ago. And she used to talk about this subject. She is absolutely great when it comes to the ground reality or working with the ground reality. So, Meenakshi ji, I'm so thankful that you are again on a Foxy platform. And I'm sure when our podcast on these subjects will be heard again and again, automatically one day our efforts reaching to the government, reaching to the NGOs will get benefited. And as you say, instead of sanitary pads, the menstrual cups will become more common.
Thank you, ma'am.
So thank you so much. And I'm sure you know, Meenakshi ji, our pattern is Supriya and you remain. And I will be joining you from the viewers link.
I'll just
Very
introduce her,
nice, ma'am.
Madam.
Yes.
Thank you.
So just to formally introduce Dr. Meenakshi Bharat, she is a gynecologist, being a specialist since 1985. She specialized in the fertility work. Her medical practice consisted of making it easy for the couples to undergo treatment to have children. Prevention is better than cure has been always been her mantra. Her other passion stems from this mantra as she looks to prevent disease created by improper management of garbage. From segregation to compositing by to using only reusable utensils have become a waste, having a waste-free wedding for her children. Having retired from active medical practice in 2018, Madam she has brought passion for gynecology and waste management together in the campaign Green the Red. That was very famous throughout when you were doing, Madam. So her aim is to make all women menstrual hygiene products like cloth pads and menstrual cups. She wants women to enjoy their periods, not dread it, and to ensure that no trash comes out of it. Advocacy has led her to talking to the state government in Karnataka and spreading this concept of sustainable menstrual products usage among gynecologists across India in January 29 when it was a AICOG. She had also trained many OB/GYNs across India regarding this. She had been a prime mover in making rotary change to distributing cloth pads and menstrual cups instead of disposable sanitary pads. Her knowledge in gynecology has eased the fears about using a menstrual cup in over 1 lakh women and converted them to having rash free, trash free, and cash free periods. So, this is Dr. Meenakshi Bharat. Madam, welcome you to this podcast and let us have a dialogue on the subject. Thank you.
I,
Thank you,
I
madam.
like the word rash free, trash free, and cash free. Fantastic.
Thank you, madam.
Thank you. Thank you. Enjoy your dialogue, Jayasree and Meenakshi ji. See you sometimes physically
Sure.
soon.
Zarur.
Hi, madam. So, madam, it was wonderful to have you because really you are very popular and everybody knows. Once I was circulating the flyer of this today's podcast, many people, I got several messages that she is a very good speaker. And on this topic, madam has the best of the knowledge what she can impart to all of us. So, just to start, madam, what inspired you to focus on sustainable periods? And how do you think we can make menstrual health more environment friendly?
So in 2010, when I started working on garbage, we segregated the waste, and then we found that wet waste, dry waste segregate kiye. So what was left? What was left was the hazardous waste. And the biggest hazardous waste was the sanitary waste. So when we started looking at how can we just, instead of just putting it into packets and putting a cross on it and still sending it to the landfill, we started looking to see if there was something else that we can use instead of the disposable sanitary napkin. So this is the disposable sanitary napkin, which all of us have used. And all of us have had such a difficult time during our periods. For 40 years, I used these pads and I was very uncomfortable. And as a doctor, you're working 36 hours and it really drives you around the bend. When I discovered this menstrual cup, I was delighted. So comfortable, so easy to use, so easy to wash, and you forget that you're having your periods. So, as against these pads, this is just the biggest boon. And to my, when I was doing my MD, my thesis was the suction. Uh, Suction cup that is made out of silicone to see how we can help delivery comfortably. And so I came back to the same silicone here after so many years and just love this product because it is so comfortable, so easy to handle, and so cost free.
Yeah.
One cup will last you 10 years, as against you will be using 1,800 pads in those 10 years. So, no trash, no rash. It is really healthy for women. It completely solves their problem, including the pain that they get during their periods is reduced because this cup produces a suction while sitting in the vagina. It produces a negative suction which helps to pull the blood out through the cervical canal faster. And so those little clots that produce dysmenorrhea is pulled out faster, and therefore your dysmenorrhea is reduced. So, on the whole, if we want women to have happy periods, we need to change to using this menstrual cup. And any number of women, after they have changed, they have come back to us and said, "Thank you very much for making our periods comfortable." So this is how I started working with the menstrual cup. And to add to it, the gynecological knowledge that all of us have will help to solve all the fears that otherwise come in. So there is no problem with inserting this. Remember, we have a head that comes out that looks like a coconut
Yes.
when we deliver our babies. So what is the problem in putting this? And you, to put this, you have to reduce the diameter and then put it inside. And once you put it inside, you let it go and it expands, and the vagina opens up, and the vagina forms a beautiful seal wherein there is no leakage of blood. So you actually don't even feel any wetness because there's no blood coming out. So that is the advantage that women and 18 to 20-year-old girls can do to solve their period problem. So no pain, no cash, and really no trash, because everybody feels very bad to throw their pad out into the open.
Yes. So wonderful. This is actually, madam, this menstrual cup workshops used to go on. We used to have some CMEs where it was shown the way you have shown today. So there were many CMEs where the chairpersons, the concerned person, resource person used to show this, and it was really wonderful. And what you said, it decreases the menstrual, that dysmenorrhea.
Dysmenorrhea.
That's
Yes.
so important because many girls they suffer from this phobia. Usually the young ones. So wonderful, wonderful that you have had the model and you are showing to our audience. Everybody will benefit from this, and many will be motivated to take this, use this.
So
So
if
thank.
all gynecologists use it, then they will be able to recommend it to the others much better, because पहले इस्तेमाल करो फिर विश्वास करो.
Yes, wonderful. Yes, we can be more confident to tell to our patients,
Yeah,
right?
correct.
Yes, madam. Now, many people are unaware of the environmental impact of traditional menstrual products. Can you elaborate on the effects of single-use products and the benefits of switching to sustainable alternatives?
So every day when we use a disposable sanitary napkin, we at least use 2 to 4 sanitary napkins in a day. And with 336 million menstruating women, with most of them taking to this disposable sanitary napkin, क्योंकि over the last 30, 40 years, there is so much of charcha, so much of popularity, because these pads cost money. And every set of pads for every period, every woman will spend anything between 50 and 150 rupees. So just imagine how much money she will spend in 1 year. In 1 year itself, she will spend between 1,000 and 1,500 rupees. So she's spending money, and after using it for a few hours, it has to be thrown out. And this pad will hold only 5 ml of blood. It cannot hold any more than 5 ml of blood. So you have to throw it out. And the sad part of it is, as the blood comes down in the vagina, there is lots of bacteria that is normal to the vagina. And when the blood comes down, the blood and the bacteria mix up, and then they land on the pad. And when they land on the pad, you're wearing the pad for the next 4 to 6 hours. The bacteria starts multiplying because blood is food for the bacteria. And so when the bacteria multiply, they produce gases, and those gases make the pad stink. So, because the pad stinks, periods got a bad name, that it is dirty.
Yes.
Periods is not dirty. The pad stinks because it acts as a lovely petri dish for the blood and the bacteria to stay here. So instead, if we start using the menstrual cup, the blood will be inside the cup, the bacteria is outside, and the blood and the bacteria do not mix. And so the blood, when we pull it out after 6 to 8 hours, we pull it out, the blood doesn't stink because the bacteria is outside. So that's another very big advantage, that the blood doesn't stink. The other part I said, this pad can hold only 5 ml, but the cup will hold between 15 and 20 ml of blood. So the advantage to the woman who is using it is you don't actually need to change the pad as often as the pad. You don't have to remove this cup and wash it and put it back again. And the other advantage is that when you are passing urine or stools, you don't have to remove this. This is in the middle passage. And we need to introduce it to the young girls, telling them that this is in the middle passage and you can pee and poo without removing it. So you can put it on in the morning, go to work, go to colleges, and come back in the evening and then press it like this, pull it out in the bathroom, the bath area of the bathroom, and then you will find that, you can drop it and wash it and put it back again. So, no problem at all. There is a small learning curve. You and I didn't become doctors overnight, right? We had 5 years of training plus 3 more years of post graduation, 8 years of training. This doesn't require that much time. This requires one period. You need to learn to put it in and you need to learn to pull it out. And you need to learn to pull it out by pressing the bottom of the cup. You can't pull the stem. So when the cup was designed, it was designed, according to the tampoon because the tampoon had a tail. So they put a tail on this and then women used to pull it. If you pull it without pressing the bottom of the cup, then the vacuum seal is not released. When the vacuum seal is not released, it sort of hurts the vaginal wall. So therefore, remember, you must press the bottom of the cup and then pull it out. The vacuum seal is released and then you'll be able to wash it and put it back again. So that is for the women who are 16, 18, 20 plus. And once you are married, there is absolutely no problem. So the other myth that is there is that the hymen is intact. If the hymen is intact, then how did you and I get our periods before we actually became sexually active? So for every girl child, the gynecologist knows and the pediatrician knows that there is a hole in the hymen from birth. Very few people have imperforate hymen. So the hole in the hymen allows the blood to come out, and that's how you know that you are getting your periods. So if you're getting your periods, there is a hole in the hymen. So you don't have
Yes.
to worry. The myth about imperforate hymen or a virgin is just not there, not true. So all mothers should be told about it as to about this hymen having a hole from birth. And the other thing that I would like to tell is that growing up is very exciting. Can you see this? This
Yes.
starts, दिखता है?
Yes. दिख रहा है.
So
Yes.
this is the beginning of the period. Around the time the teeth fall off and the permanent teeth come up, that is around 7 years, the girl child suddenly starts growing tall. And when she starts growing tall, then the next development that happens is the breast development. With the breast development, you must sit down with your girl child and talk to her and tell her that बेटी तुम बड़ी होने वाली हो, तुम बड़ी हो रही हो, एंड पीरियड्स आएगा एंड उससे कोई घबराने की बात नहीं है. यू हैव टू टेल देम that they need not be scared about periods, and there is nothing harmful about periods. Periods is very important for our long term health, for the long term health of the woman. So then as they get armpit hair, then you tell them about the periods and the girl starts getting the periods, and you have to tell them as to what to use. So instead of telling them to use the disposable sanitary napkin, talk to them about the cloth pad. This is the cloth pad, and this is newly designed. It is just not the cloth. There is a jacket at the back which is leak proof. Now, what used to happen before is that this pad would get wet, and this only holds 5 ml of blood. This would soak the uniform, and then the girls used to be very ashamed or very shy about the fact that their school uniform got soaked with blood. So there's nothing to feel ashamed of your periods. It's very important that women have their periods, because periods give us good hair, good skin, lovely, figure, and also make our bones strong. And also it gives you, protects your heart in the long run. By the time we are 40, we don't get heart attacks when we are, in
Yeah.
our 40s, because we have the protection of the estrogen that is produced by the ovary. So girls must use cloth pads, and this jacket they cannot make, but this cloth pad they can make themselves, and they can wash it with just soak it for 10 minutes in a mug of cold water, and then wash it. And once you have washed it, dry it out in the sun. The sun is the best sanitizer. You don't need anything else. So if you dry it out in the sun, it will be dry and ready to use the next morning. So 5 pads is all you need to do, and the 5 pads will last you 2 to 3 years. So just imagine how much money you will have saved. हर
Oh
एक
my.
साल में about 1,000 to 1,500 rupees if you spend on disposable sanitary pads. This one will be about 300 to 400 rupees, and it'll last you 3 years. So you save money, you have a comfortable period, and the cloth pants don't stink as much as these. Stinks a little bit because, yes, the blood and the bacteria are there, but there is no reason for this to it to stink as much as the disposable sanitary napkin. So there you are. This disposable sanitary napkin has lots of chemicals in it that make it, harmful to our body, because this is so close to our vagina. So, because it is so close to our vagina, therefore, it makes us get white discharge. It gives us itching in the groin. And when we throw this, it gets burnt, and incomplete burning, because if it has to be burnt, the pad has to be burnt at 800 degrees centigrade. Remember, 40 degrees centigrade भी बर्दाश्त नहीं होता है. So at 800 degrees centigrade, where will we do this burning in an incinerator? Therefore, if we change to cloth pads, economical, no itching, no rash, the child will be very comfortable, and you can carry one extra pad to school so that you can change, come back, soak this in cold water, not in hot water. Soak it in cold water. Hot water makes the blood stain the cloth. So soak it in cold water, and you will find that you're totally, totally comfortable. And 5 pads can last you 2 to 3 years. So for the girl child, the mother needs to understand what are the changes that are occurring there, and sit her down and talk to her. घबराने की कोई बात नहीं है. तुमको कोई कैंसर कुछ नहीं, ब्लीडिंग वेरी कॉमन. गर्ल्स थिंक दैट ब्लीडिंग हो जाती है तो कैंसर हो गया है, घबरा जाते हैं. सो यू सिट डाउन विद देम as a mother, as an ASHA worker, Anganwadi worker, and you talk to them, because most people don't come to the gynecologist. The mother is the first, person to they talk to, and then it's the grandmother. So between the mother, the grandmother, the ASHA worker, and the Anganwadi worker, girls must be told about this. And once one set of girls are told, they will talk to their friends saying, Ghabrao mat, there is nothing to worry. Periods is a blessing from God, not something to be scared about, not something to hide, not something to worry. Correct?
Yes. Yes,
So
madam.
the mother needs to be counseled so that she can explain to her girl, and also at the same time explain to the boys in the house that periods are normal. The boy, as they start growing, the girl grows taller first, and then the boys start gaining height. When the boys start gaining height, they get a mush and a beard. So
Yes.
we don't से अरे मूछे आए, बियर्ड आया तो खराब बात है. The same way, we should be able to tell the girls that it is not bad, it is good, very good that you have started your periods. Now you become a grown up woman, and by the time you're 20, 25, you will be get married and you'll be able to have your own baby. So the uterus, this little uterus, is the one that holds, is the size of the fist, your fist, and the baby sits in it and grows and comes out as a 3 kg baby in 9 months. It is a miracle that occurs, and that miracle can only occur if your uterus is functioning normally and you are getting your periods. So, शर्म की कोई बात नहीं है. बिना शर्म के, be proud that you, as a young girl, is getting your periods. And the other thing that I must tell is that there are three holes that women have. Men have only two, one for urination and one for stools. Women have in front a urethra, in the middle the vaginal opening, the introitus, and at the back is the anal canal. So children need to be made aware. Lot of women don't know that there is a third passage that is available with us. So God has designed us beautifully, and we should be proud of what God has given us. Our ovaries, our periods, our uterus is all a blessing for us. So this is what you must understand.
Yes, madam. So amazing it is to be a woman, the way we have been designed, and the periods. Periods, it is really a blessing. The ones who don't get the periods, if the periods are delayed, the amount of anxiety the parents face, and they at a very early stage they'll come कि क्यों नहीं हो रहा है, because the colleague is having, इनके यहाँ उनके बच्चों को हो गया. This compare comes, and they are very scared that something wrong with their children. So having periods in time is a really blessing for the person. So madam, the way you have explained the use of menstrual cups, the way the bacteria, how it holds in the vagina, if the pads are there, so we can see the drastic difference the way you have explained to us. And I think everybody should take this message, and it's really amazing. Madam, I would also like to, you have already told about the myths that they are. Any other myth also you can tell, and how can individuals, particularly in urban and rural areas, access to these sustainable menstrual products and practices, and what role can policymakers play in promoting menstrual health and sustainability? So,
Correct. So, basically, the promotion of the cup actually lies in the hands of the gynecologists. And if the gynecologists train the ASHA and the Anganwadi workers, and through all the PHCs, we talk about it, and her clinic में posters लगाएंगे कि आप कैसे अपना how can you have a hygienic period by using the menstrual cup, then the word of mouth will spread, and women will learn about it, and they will come to the gynecologists and say, can I use it? कैसे इस्तेमाल कर सकते हैं? तो हमारे आपके और हमारे हाथ में है इसका प्रोपगेशन करना. सो अगर आप सब all the gynecologists, and अभी तो Foxy ने has taken this up as a huge program, so it will save you know, thousands of rupees, make women healthy during periods, and, save a lot of money and save a lot of trash. So the environment is saved hugely. जब आप ये कप इस्तेमाल करते हो, 200 या 300 रुपीस से ज्यादा नहीं है, और ये 300 रुपीस आपको 10 साल आएगा. तो सोचो, अगर 900 भी दिए तो 10 साल में 90, एक साल में 90 होगा, 90 रुपीज. It will be less than 10 rupees a month. 10 rupees ke liye you will only get one disposable sanitary napkin. So the cup is comfortable, the cup is economical, the cup is hygienic, and the cup helps you to really have a comfortable period. So you will love your period. Instead of hating your period, you will love your period. And how can we promote it? We can promote by talking to everybody. Like you said, that if we have little CMEs, little talks, you teach your nurses while the patient is waiting for the consultation with the doctor, you can have the nurses give a small little 5-minute pep talk about how, instead of using the disposable sanitary napkin, please use the cup, and for the young adolescent, use the cloth pad, which will help her to have excellent periods, comfortable periods without any problem, without any itching, without any rash. And again, a gynecologist is an icon in her own society. So she needs to talk about it and then spread the word. How did the disposable sanitary napkin become such a big name in the 70s and 80s? Because gynecologists started talking about this and said, cloth pad अच्छा नहीं है, ये अच्छा है. गलत फहमी है, ये अच्छा नहीं है, क्लॉथ पैड अच्छा है, और उससे सुपीरियर इज द menstrual cup. So you as a gynecologist who is fortunate to still getting your periods, unlike me, I am menopausal, तो मैं तो इस्तेमाल नहीं कर सकती हूँ, पर आप लोग सब इस्तेमाल कीजिए, have a comfortable period, and then you can talk about it with conviction. You can talk about it with conviction to everybody. So that is the reason why, we all need to promote the menstrual cup. The same way that we've been promoting so many concepts. Foxy has taken up anemia prevention, PPH prevention. The number of subjects that Foxy has taken up is, tremendous. So if all gynecologists will use the menstrual cup and then talk about it to their patients, then it will transform a woman's life. Instead of being uncomfortable and, not being able to work as comfortably when you're not having your periods, this will make it like you don't have your period. So I had to wait for menopause to stop using my pads. With the menstrual cup, you can immediately stop using those disposable pads and have a rash free, trash free, and cash free period.
So wonderful. This line, Dr. President, Madam, she also liked it so much. It is really rash free because, Madam, once during the summers or if there is wet area there, the rashes occur. Trash because of the waste and cash because it is so affordable. It is so, it doesn't cost anything, like you have explained, Madam. So, the green wedding, I wanted you to throw some light on your son's marriage, the way you had managed everything, that there should be no environmental waste, the trash that we used to collect from the huge weddings, usually after a wedding party or any other party. After the event, it looks like as if lots of garbage is there. So, how did you plan to do such a wonderful event and managing everything? So, just tell us about this. Let us all know about this.
So basically, what we must do is to not only in the wedding, हर दिन नथिंग डिस्पोजेबल. आप प्लास्टिक बिल्कुल इस्तेमाल नहीं कीजिए, थर्मोकोल नहीं इस्तेमाल कीजिए. एनीथिंग दैट इज यूज एंड थ्रो you must not use. So especially during a wedding, it is so many disposables we use. If we stop using it and go back, India was very sustainable till we decided to follow Western practices, till we decided to use the paper cup for drinking our coffee. चाय हमको कुल्हड़ में मिलता था, एंड चाय हमको वो ग्लास में मिलता था, and they used to wash it. There is no problem. So we need to understand that we can do without disposables. So carry a bag. All your groceries must come in a reusable bag, and you can do any event, birthday, marriage, 50th birthday party, जो भी चाहिए, मेनू लगाते वक्त say, how will I serve this? If you say that, then you will be able to have an eco-friendly event without any disposables. So that will save the environment. On one side, you're saving the environment by not using disposable sanitary napkins, instead using the menstrual cup. On the other side, stop using disposables, and the world will become a more healthy place, and healthy for you and me.
Yes.
Nahi, we are already reached the stage where there are microplastics in the brain. And
Yes.
how did it reach the brain? There is a blood brain barrier, but the microplastic is so small that it crosses the blood brain barrier and reaches the brain. It has reached the placenta, it has reached the baby, and it has reached the brain. So we are destroying, हमारे हाथों से हम अपने आप को डिस्ट्रॉय कर रहे हैं. So if all of us, and gynecologists are icons in their own area. तो अगर आप बोलोगे कि पेपर कप नहीं इस्तेमाल करेंगे, हम स्टील कप इस्तेमाल करेंगे, एंड वो स्टील कप इस्तेमाल करते वक्त, once you have used it, just put it into a bucket with some soap in it, and then it can be washed without any problems. Just have to rethink it. We used to use green cotton material for our scrubs.
Yes.
Now, suddenly, we are using disposables for our scrubs.
Mm.
Each, because of the pandemic, those disposables came in, and it has filled the world with disposables, which are plastic again. So, we need to go back to the time where we used to have green cotton scrubs. So, आप भी सोचिए कि आपका स्क्रब अभी ग्रीन कॉटन होना चाहिए, not disposable nylon.
So nice. Yes, ma'am. Yeah, I wanted to ask you, madam, these young adolescents these days, they are so much onto mobile phone. The screen time has increased so much, and they don't listen. Mostly, if we say, you do stop this using this menstrual pads and you take this menstrual cups, so it is very difficult. What I feel, I can come across many adolescents where they come with their mothers for the dysmenorrhea, for periods problem. Many a times PCOS, usually in PCOD for 3 months, 6 months gap during the periods. So I always encounter with them. But mostly, whenever we try to counsel them to lose your weight to get treated for PCOS or use this menstrual, तो mothers they tell कि they will they buy huge numbers of menstrual pads and they use it, and they are not ready to switch over to this or that. Very difficult to counsel these children, these young adolescents. So what do you think, this social media, or how can we put a positive impact so that they can be more user friendly for these eco friendly things?
Yeah, so I think that, like I said, if we can explain to the girl child how you get your periods, and at this it is at that time that we talk to them, then we can change the whole generation. So it's in our hands to do that. Counsel the mothers, who will then counsel the child, and make the mother change. When the mother comes to the hospital for any reason, at that time, talk to them about the menstrual cup instead of the disposable sanitary napkin, and they will be able to change. So benefit देखना चाहिए. The ladies must see the benefit. And I have seen every woman that we have spoken to, they find it so comfortable that they don't go back to buying a disposable pad again. So remember when we used to click Kodak ka picture, and we used to buy those reels, and if we went on a holiday, we would buy 10, 15, 20 reels and then come back and then look at it. Today, the mobile phone has changed the whole scene of taking pictures. So we don't have to buy anything, and it is so economical. The same way, we need to forget about the disposable sanitary napkin and use the menstrual cup. It will happen, but we want it to happen earlier,
Yes.
not later, because the environmental impact is so big. And if we want to get rid of something called as period poverty is there everywhere in the world. It is there in India, it's there in America, it is there in the African countries where they don't have enough money to buy these, but they will definitely have enough money to buy this. And once they buy it and use it, they will be so comfortable. They have actually done in Kenya, they have done research where they have given it to the younger girls, 14, 15, 16-year-old girls, and taught them how to use it. And once they have started using it, they are attending their schools more regularly and not missing their schools because of period. So that is something that we need to explain to them, and they will, once one girl child understands it and experiences it, she will then tell everybody, because that is the way. Or I give it to every girl who is getting married. That's the best gift that I can give them.
Yes, so nice. So, madam, it is wonderful to know this all things. What drives your passion for advocating sustainable menstrual health, and how do you think your work can positively impact individuals and communities? Although you have been a infertility specialist, you have been counseling to the couples to conceive and how to get. So, this passion of yours still carrying on, and how do you think that you can carry on this passion?
I think we can do it without any problems. So, one of the things that I wanted to tell was every young mother must not make her girl child fat. If she makes them fat by giving them fatty food, by giving them ice creams, by giving them pizzas, what will happen is if the girl reaches 30 kgs by the time she is 7 to 8 years old, the fat in the body will trigger the brain to produce the GnRH analogs, which will make the will make her to start her periods earlier. So very important, whoever is listening, to not make your girl child fat. So ज्यादा एक्सरसाइज करो, ज्यादा fruit खिलाओ, ज्यादा vegetables खिलाओ. Don't make them fat. Treat them once a week or once in 2 weeks with something sweet on a regular basis. Don't give it to them. So don't get her to start her periods earlier. Once the girl child starts her periods, within 2 years the bones will fuse. So if the girl child starts her period at 9 years, she will not attain the full potential of her height. She will stop growing at 11 years. Otherwise, we used to grow till 14, 15, 17. We used to be taller. आजकल लड़कियां मोटे हो रहे हैं and गिड्डे हो रहे हैं. So
Right.
that's the problem. So we need to understand, and gynecology helps you to understand all these nuances that will change the situation for the girls. And once you have used this, you don't have to worry. Every woman can use this, and you can work in the tea estates, you can work in the sugarcane industry, because you don't have to have a hysterectomy just because you don't like your periods and the periods come in the way of your work. So start using the menstrual cup. You will be able to work without any problems, without any difficulty, and you will not need a hysterectomy. It is important not to have an early hysterectomy, because if you have a hysterectomy, then what happens is the ovarian blood supply is compromised and you will attain menopause faster. If you attain menopause faster, then what will happen is your bones will become soft and you will, have osteopenia earlier than you should. So there are so many repercussions of the periods. So from a girl child to a grandmother, the repercussions are there. If you help to solve this problem and remove the sort of fear that we have, oh, periods are dirty, periods are horrible, periods are difficult. Once we start using the menstrual cups, all these things change. So we can do it without any problems.
So excellent, madam. So you have well explained that it means like periods, we need to educate the children, educate the parents, so and especially the mothers, and we can propagate this through the ASHA workers, through all the healthcare workers, we ourselves, so that it is true that once we explain to the patients, to the mothers, ki this is good, we should use this, and word of mouth it spreads, and really they trust us because we are the really icons in our own places. So Ganik, we are fortunate enough that we can uplift the society through our own knowledge, and we can disseminate this knowledge,
Correct.
and really these people, they listen to us. So
Correct.
Ma'am very rightly said, and this period friendly menstrual cups are really awesome.
So if you look at my sari, this is an Assamese sari which is green and red. So the idea is all the red should turn into green. So आप ही सोचिए, हर दफा जब आप पीरियड की ख्याल करते हैं, you will say, let us convert all the red into green. And
Mm.
you'll always find me wearing a green and red sari.
Okay, so yeah, this is noticeable, madam. So green the red is your motto.
Yes, absolutely. So green the red.
Yes, that I can see. And I think our audience would have must have really gained a lot from this, and everybody will be confident that years together you have been working on this, and you have got a very, very good experience regarding this menstrual cups and this environmental eco-friendly products to be used. And really, these menstrual cup sanitary pads are not to be promoted.
करेक्ट. तो अगर आप ये देखेंगे, फ्रॉम from menarche to 18 years, you need to use cloth pads. And once you're 18 years or you're married, then you can use the menstrual cup. So हर जगह मिलता है. आजकल फार्मेसी में मिलने लगा है. It's available online. You can put menstrual cup in your phone, and you will get many varieties. So what is the menstrual cup that you must choose? The vagina is a flat organ, and you don't need a large menstrual cup at all. This medium size, this is the medium size menstrual cup, is more than adequate. And this has a capacity, the equivalent of 3 pads. So a menstrual cup can hold between 15 and 20 ml. And पूरे period में आपको 60-70 ml से ज़्यादा नहीं bleed होता है. So this menstrual cup needs to be medium. You don't have to look at a large cup at all. Please look at medical grade silicone that goes to make the cup, and please look at Make in India cups. Lots of cups are made in India and they are fabulous. So you need to decide that. Don't get worried. Medium sized menstrual cup made of medical grade silicone, made in India. These 3 points, if you look at, then you will get the cup, and it's available in India, and it's not expensive. Don't have to buy a foreign made cup at all. अभी इंडिया में हर चीज मिलती है, और ये
Yes,
भी मिलती है.
so nice. Yes, ma'am. Yeah.
And
Yes,
if you
ma'am.
use the menstrual cup, then instead of, suffering your periods, you can be happy like this. You can run a marathon. There is no problem. And all women who use it, अगर आप फील्ड्स में काम करते हैं, या स्विमिंग करते हैं, या कुछ भी करो, if you use a menstrual cup, you will have happy periods, and you will be able to do much more than what you would have done with the disposable sanitary napkin.
Yes. I remember one of my teachers used to say this menstruation is not a disease, it is just a physical phenomena. Girls
Yes.
can swim, ride, run, and play all the games she can. So this is what I take from you.
Yeah,
And
absolutely.
so we'll try to spread the word. The basic point I understand is we have to teach and teach and teach so that this message should spread through the social media or one-to-one contact through the patients, through all our healthcare workers. And this will, in coming years, I think it will be the most sought out and usable thing that people will start using and acceptable.
Correct.
So today is 1st of June, madam, and this is the first day. The podcast starts every first to 30th, and 31st usually comes Dr. Sunita madam. The month it has 31st of so when they say, my friend said today you are the opening batsman for this month. So I'm very happy that I had you, and really I wanted, because I deal with the adolescents, I really wanted you to come to the podcast, and we wanted a clear up and open discussion about this menstrual cups, how to maintain the hygiene, and the adolescent young girls, they should be teached, they have to learn lots.
Yeah,
Thank
so I forgot about the hygiene. Remember that you only have to wash it with plain water. No hot water, no boiling, no soap. Like I had already said, the vagina is an unsterile organ. And none of us wash our partners with hot water and soap before we have intercourse. So there is no need to treat the cup any differently. Just wash it with plain water and insert it inside immediately, so that that water itself acts as a lubricant to push it inside. So there is a small learning curve. एक दो टाइम अगर आप इंसर्ट करके ठीक से इस्तेमाल करें, तो then you will get used to it and you will have no problem.
Yes, fabulous. And so your message that पहले इस्तेमाल करें फिर विश्वास करें, that was wonderful. And the next one, madam, rash free, trash free, and cash free.
Yeah.
So it is excellent to use this product, and we'll try our best to propagate this, to promote this, and let our Indian adolescents grow up with this and accept this beautiful thing that you are
Yeah.
passionate about. Thank you very much,
Thank you.
madam. A last
Thank you.
message to everyone from you.
Probably use it. Only if you use it can you believe in it. So अगर आप इस्तेमाल करेंगे, जैसे अमिताभ बच्चन ने बोला, पहले इस्तेमाल करो फिर विश्वास करो. अगर आप इस्तेमाल करेंगे तो आपको उस पे विश्वास आएगा. Don't lose out this opportunity to have a happy, comfortable, and trash free period.
Yes, sure. We will do it, and we will definitely work on it. So thank you so much, madam. Thank you
Thank
for
you.
coming to this wonderful podcast. Thank you, madam.
Thank
Thank
you.
you.